Hi, my name's Lee Matthews. I'm one of the physiotherapists that work in the pain management team at Queen's Hospital. I'm going to guide you through some gentle stretches for your low back. So it might be that some of you have got conditions where you get either low back pain or back pain with leg pain. So the idea of these stretches is that they're done at a gentle pace, that they're done at a level that's suitable for you, and the aim is to do them little and often. So it might be that you bookend your day with doing a small amount of stretches in the morning and a small amount in the evening. We're aiming to move at a comfortable pace. We relax during the stretch, we don't bounce, and I'm aiming to do 2 on each side for about 10 seconds or thereabouts. So we're going to start off by doing some gentle stretching to the side. I'm going to reach over to the side of the chair and relax into it, and you could either be holding onto the arm of the chair or just be relaxing your hand inside. Just move at a comfortable pace, work to the soft edge of the stretch and hold for about 10 seconds. And then back to the middle again. And the same to the other side. So you might find one side's a lot tighter than the other, and that's fine, but hopefully by doing a little bit each day, you find that movement improves. So again, and we'd be encouraging you to do these little and often. So even on a bad day, you might have a stretch. You might find you only go a fraction as far, but that's still going to be useful, and it's still going to ease up any tension, lubricates joints, and helps to restore movement even if you're having a bad day. So the next movement we're going to do is a rotation stretch. So my bottom's slightly further from the back of the chair for this one. I'm going to take one hand and place it on the opposite thigh, and then I can either reach for the back of the chair or the arm of the chair, and I'm going to slowly twist round and hold and sustain that stretch. So again, you hold on that soft edge of the stretch and feel that all the way up through the spine there. And again, same on the other side. So I take my hand, I place it on the opposite thigh, I'm going to reach for the arm of the chair, and I'm going to twist all the way around there. And relax. So again, you might find that one side you go much further than the other, and that's perfectly fine. It's very often the case that we aren't perfectly symmetrical. So again, the same to this side, hand over the opposite knee, and I look all the way around. And just hold that on the soft edge of the stretch, count to 10. And then one more time on this side. So again, hand over the opposite thigh. And again, you can give some resistance on that thigh if you want to just give an extra stretch there. But again, work at a pace that's good for you. I don't mind a little twinge, I don't mind some bumps and creaks, but if it's making you really sore, then you're pushing too far. So now we're going to practice bending forwards in a seated position. So this time I'll take my hands, pop them on the front of my thighs, and I'm going to slide down in front of me. So you might find the stiffness, it might be pain or tightness in muscles in your back or tightness in joints. And again, you hold that position about 10 seconds and then slowly back up again. So through avoiding bending forwards because it hurts, sometimes it then becomes harder and harder to do things like putting your shoes and socks on or putting on your trousers and things. So by practicing this each day in a controlled way, it can actually improve your flexibility and reduce the amount of discomfort that you feel when you do try and next do your shoelaces. So again, down. Now if you find that your tummy gets in the way, it might be your legs are a little bit further apart when you do this stretch. We hold and sustain it, and then back up again. So by repeating this on a daily basis, hopefully it will get easier to do some of those movements that you do in your day, and you might find that you get fewer symptoms when you do try and do those things. For the next stretch we're going to do, we're going to stretch the muscles around the bottom area and around the low back. We're going to do a gentle knee hug. So I'm going to take my leg and bring it towards my tummy, either supporting under the thigh or in front of the knee. So again, if you've got a bad knee, you might hold it in front there, or it might be you feel more comfortable under here. But either way, we hold and sustain that stretch. And then again, same on the other side. So I bring my knee up towards my tummy, and again, either supporting under the thigh or in front of the knee. And we hold and sustain about 10 seconds again. Now again, you might find that one side goes a lot further than the other, so you work to your own individual limitations. And again, 2 on each side. So up it goes. And you might feel it a little bit in the hip area, or it might be more around the low back area, you feel that. But either way, we hold and sustain that movement. And then the same on the other side. So the next stretch we're going to do is a gentle curling up and then sitting up nice and tall. So if I guide you through it, I've sat forwards on my chair here, there's quite a bit of space. And what I'm going to do is try and curl up into a ball, and again try and hold that for a few seconds and feel that stretch through the whole spine. And then I do the opposite of that, and I bring myself up big and tall like a sergeant major on parade, sticking my chest out and hold for a few seconds, and then again back into curling up into a ball. So again, I hold a big stretch in this position. And again, it's all the way from my tailbone all the way to the top of my neck, really, this stretch. And then again, we sit up nice and tall like a sergeant major on parade and hold and feel that stretch and relax. Now, if you found that was a bit much, a gentler form of it is just to roll from the pelvis. So what I'm going to do, I just gently go into a little bit of a slouch position and hold. And then I just roll forwards with the pelvis, a bit like I'm sticking my bottom out a bit. And then again, into a little bit of a slouch. And then back up, so we've got a big curve in the back with that position. So that's 2 versions. I think the more effective one will be the bigger stretch. But again, you work to what you can tolerate on a good and a bad day, but we'd much rather see you do these things little and often. So the stretch we're going to do now is a stretch for the back of the leg, our hamstrings, we call this area of muscle. So I'm going to again have my bottom towards the front of the chair. I'm going to bring one leg out in front of me, and you can either have the toes up to the ceiling for the more challenging version of the stretch. A slightly easier version is to just have the toes pointing in front of you. Now, keeping the back nice and straight, I'm going to bow forwards. So you'll feel this stretch in the back of the leg there, your hamstrings. We find that with things like low back pain, especially when there's leg pain involved, these muscles can get really, really tight, especially if you've got the sort of sciatica on one side, you'll find the leg muscles are quite tight there. So again, we hold and sustain the stretch for about 10 seconds, and then the same on the other side. So again, I bring my leg out in front of me, I hold, and I sustain 10 seconds. And again, either my toes to the ceiling or out in front of you for a slightly gentler stretch. And then relax. Same again on the other leg. So I go back to this side. So again, if you've got sciatica, I would most definitely expect there to be a tighter set of hamstrings on one side to the other. So you might find you go a lot further on one side, and that's absolutely fine. It's work in progress. But the best benefit from these will be gained if you do a little bit each day. And then the same on the other side again. So the next stretch we're going to do is one for the calf muscle. You might have seen this done leaning against a wall. So you find yourself stood against a wall and you bring your leg out behind you that you're going to stretch. My back leg stays nice and straight and my front knee bends as I go forwards. I hold and sustain this for 10 seconds. And as with all of these, the same on the other side. So again, I bring my leg out behind me, the other one this time. That back heel, notice the heel is on the ground there. I'm not lifting my leg up because that would take the stretch off. That back knee stays nice and straight. And I control this stretch by how far forwards my hips come over that front leg. So I bend that front knee. What you don't want to be doing is bending forwards because that's not really going to change the stretch. This is about where your hips are over those feet. And I hold, I don't bounce, I hold and sustain this for 10 seconds again. And then relax. So throughout the stretch, my feet remain parallel, they're not turned out or inwards. And the other way you could do it with a chair, it would be holding onto the back of the chair. So again, I step behind me with one of my legs. So our last stretch we're going to do is one for the front of the thigh. I'm going to hold on to the back of the chair and keep my sort of hips tucked underneath me. I bend one of my knees and hold onto a trouser leg there. So you might even have a towel or a belt around your ankle, and that's fine as well. But the important thing is that we don't bend forwards and the knee doesn't come up in front of me. For this to be an effective stretch, my knees stay in line with one another and I keep my bottom tucked underneath me. And again, whatever you've done on one leg, you do the same on the other side. So again, I grab a hold of my other ankle this time, I keep my knees in line with one another, and I tuck my bottom underneath me. So I don't bend forwards, I don't overarch from the back either. I keep that nice, gentle, sort of neutral position with my pelvis there. And then relax. If you found that was a bit of a challenge, there's ways of doing this laying down as well. But another way we could do that is if you were holding onto a chair or a table, or in my case a wall here, you could even pop the leg up behind you onto a chair. And again, I keep my pelvis in a nice neutral position there. My knees are in line with one another, and you should feel a stretch on the front of the thigh there, those hip flexors and quads muscles. And again, the same on the other side. So if you've got a bad knee or if you find this one's difficult, it might be that this isn't a stretch that's good for you. But there's different ways of modifying it, and I think if you're struggling, then maybe speak to your physiotherapist about if there's other ways you could do it. And relax. And that brings us to the end of our stretches video. So work at a pace that's good for you and try and do them little and often. It might even be that you start with just doing a few of these and just ease yourself in gently. But ideally, we'd be encouraging you to try and do them at least twice a day. And even on a bad day, if you try and do them little and often, you might actually go less far, or even maybe do them a little bit more frequently and just do a small amount. But we know whether it's a good day or a bad day, doing gentle stretches with a long-term pain condition can be really useful. It could take about 8 to 12 weeks to see a benefit from these, and I'd often say to begin with, you might even notice a slight increase in your levels of soreness. So start slowly, start gently, but try and do them little and often, and hopefully over time you'll find that your symptoms are actually slightly improved, that you might have your pain still, but fewer of those bad days. And hopefully when you start to do things around the house, when you start to do some of the activities that you enjoy but you struggle with, you might surprise yourself and find you can go that little bit further before your symptoms are present. So have a go with them, and hopefully you'll find some benefit too.